Well, it turns out most people who get health insurance through Obamacare qualify for government help to pay their premiums. According to federal health officials, 87% of enrollees receive subsidies. Alan Combs, host of The Alan Combs Show and Fox News contributor, joins us along with Brad Blakeman, former deputy assistant to President George W. Bush, to talk a little bit more about this. Thank you both for joining us.
Hi, happy New Year.
So, Brad, I want to talk to you first about the cost of this. Who pays? At what cost is this coming?
Look, we pay. If you go back to the enactment of Social Security 70 years ago, there were 7 workers paying into the system for every retiree. We don't have anything close to that kind of young people, healthy people paying into a system to reduce the cost. And by the way, as you point out, the people who are signing up need government help. Who's going to pay for it? You and I are going to pay for it. Those people who don't need government assistance, who are supposed to get a premium benefit to Obamacare, have seen our costs go up. Mine, for instance, $240 a quarter. So Obamacare is neither affordable nor is it practical for those people who have had insurance, nor is it practical for those people who don't, and especially for young people because they're not signing up.
And the latest numbers, Alan, of those young people signing up is coming in at 30%. And if you look at the last enrollment period, the administration did project that they needed 40%. They don't have a projection of what they need this time, but they're still well below that, just 30%.
I think it's 33%. By the way, the problem with the numbers we're citing, this is from a report you're citing from The Hill. Let me read to you from what the report says. It says that 6.5 million sign-ups in 1 month, far less than the actual tally. It's also only a third of the sign-up period. And also, the report only includes sign-ups to December 13th and federal sign-ups to December 15th. 2 of the biggest states, California and New York, only reported new sign-ups, and 7 states did not report customers who were auto-enrolled in plans. So this statistically means nothing. You're not getting the full picture. So the numbers being cited in this report don't tell you much. It's only a third of the sign-up period, and the biggest states are not even reporting. So we can't know yet what the actual numbers are going to be. In terms of the cost, it's been reported by the CBO and by other economic indicators that the rate of economic inflation, of medical inflation here, and the rate of spending is at the lowest ever since the Affordable Care Act went into effect. So this has really been very good economically, and also has signed up millions and millions of people who have not had health care up until now.
So, Brad, is this a sign that Obamacare is working and will work?
Look, we're not stupid. The math doesn't work. We don't have enough young, healthy people paying into a system to make government back off and make it affordable for everybody. It's common sense. If there are 7 people paying in for every person who needs it, then it's sustainable. If it's anything below that, it is not. And there's no doubt about it that the people who are signing up why are they signing up, Alan? Because they get a benefit for signing up because the government's going to help them pay their insurance. But what about the 30 million people who don't have insurance?
Right.
This is the biggest boondoggle in the history of our country.
Sorry, I didn't mean to interrupt you, but that's why we should have universal health care in this country, like they have in many other civilized countries.
And how would we pay for that, Alan?
Well, it's a lot cheaper, actually. Universal health care would be a lot cheaper. And furthermore, Brad, what you're ignoring is that prior to the Affordable Care Act, we were paying anyway. Those who had insurance were paying exorbitant fees to cover those who didn't have insurance and would go to get their first line of health care at emergency rooms. So this actually reduces the amount of money taxpayers are already paying for those who did not have health care up until the Affordable Care Act.
What is interesting, though, and I know that you both read this, Jonathan Gruber, one of the architects of Obamacare, he himself said back in 2009 that this was not affordable. He said, and this is a quote from a speech that he gave at the time, the problem is it starts to go hand in hand with the mandate. You can't mandate insurance that's not affordable. Well, this is going to be a major issue.
What's really interesting is those people who hate Jonathan Gruber because of the things he said tell us how wrong he was. And when he says something they agree with, all of a sudden he's the greatest guy who ever lived. The problem is what I just cited earlier, which the economic indicators show that we have the lowest rate of medical inflation ever and the lowest rate of spending on medicine in this country ever. So Gruber was wrong in that statement in 2009.
But hasn't that been the case, according to the CBO, since 2010, those numbers that you just cited, Alan? I had our brain room pull those, and that's what they said.
No, we have the lowest rate of inflation in medical care ever in this country, according to the CBO, and also according to the U.S. Bureau of Economic Analysis.
But due to Obamacare?
Yes.
Please. Assuming that is even so,
it is so.
What about the cost for the individual, Alan.
Well, that's what I'm referring to, the cost of medical inflation.
No, it isn't. It isn't, because I'm paying $240 more a quarter. Why is that?
You're anecdotal. You're not statistical. You're an anecdotal. By the way, here's what I'd like to know, Brad. What plan do the I keep hearing people putting down the Affordable Care Act on your side, but I never hear what the plan is to give people affordable health care and get more people insurance.
I'll give you the plan.
Okay.
It's simple. It's really simple. The more people who have opportunity to shop around for insurance, we should be expanding insurance to all 50 states. We should be getting groups together to buy, individual businesses to group together. We don't do that now. We punish people. We punish people by saying you've only got 5 choices in a state and you don't get to bundle your insurance. Bundling insurance would be another great option for people.
Absolutely correct. The only problem is that in those red states with Republican governors and Republican legislators, they had fewer choices. The most choices occurred in the blue states, and in the blue states where people had more choices, that's where they're getting even better deals.
The standard nationally that the states have to follow. It's Obamacare. It's the top down instead of the bottom up.
And not sure that it is crossing party lines. You know, it's Republican versus Democrat, because when you look at poll after poll, everyone polled say that they think that this needs to be repealed. The latest Fox News poll being one of them, saying that 58% of people across party lines don't agree with it.
And you know what, Heather? Many of those people want a more progressive plan with greater coverage and universal health care. Among those who are against the Affordable Care Act, about a third who are against it want even a more progressive plan.
All right, well, then we know what's in it before we pass it. Perhaps we should have done that
well, that's
to begin
not what she said. She said we won't know that because so many people are adding add-ons here, what the Republicans are doing, so we can't know what's going on. That's what Pelosi meant.
All right. Got to go. Thank you both for joining us. Appreciate it. And Happy New Year.